A person with PTSD, chemically and physically, their brain's a little bit different, and they react differently to triggers and stimuli. They also react differently to some medications. So what we were seeing in 2016 and 17, and years prior, that we have data on, is we were seeing a bad emergence delirium, meaning some type of dangerous behavior either to the patient themselves or to the staff in the OR. We were seeing that really once or twice a week, consistently. Project Golden Eagle, the medication strategy, provides really a detailed strategy of preventing that behavior and also treating that behavior. So what we did was we eliminated the two most aggravating agents, medicinal agents, and replacing them with drugs that are either proven or expected to do better for patients with PTSD. It's just a simple medication strategy to improve the outcomes of a patient emerging from anesthesia.
So I required a surgery, so I was seen at the VA in Pittsburgh.
She identified herself as prior service deployed Air Force critical care nurse. And so what that gave me was an opportunity to give her a little more detail on the meds because she was familiar with them.
It was a fear that I could suffer from the emergence delirium, but I didn't even know that there were specific steps that could be taken to prevent that.
So I described to her what we weren't going to do for her, and then the meds that we would use for her. She was compliant. She was agreeable to have this protocol for her procedure that day.
Honestly, once he explained all that and started to give me that medication, I remember, going into the OR on my gurney. I felt comfortable. I felt at ease and secure. And then he was talking with me, like I said, calmly and soothingly about the next steps. And then he let me know, the medications he was going to give next, and that I was out.
On her wake up, on her emergence, so this was like the critical time. Going to sleep was fine, staying asleep was fine. Waking up is that critical period where if someone's going to have emergence delirium, that's the time to be most vigilant. When she awoke, she went to raise her shoulders and her head off the pillow. And so all I did was I put my hand on her shoulder to keep her from elevating herself any further. And I just reoriented. I said, "Catherine," I said, "your surgery's done. You're in the Pittsburgh VA." She turned to me. I repeated it again. And then she nodded and she said, "I'm done." I said, "Yes." She put her head back in the pillow, closed her eyes. A minute later, she awoke, now oriented to where she was, and her behavior was perfect. There was no emergence delirium. There was no abruptness to her behavior other than that initial when she woke up. It was really a Project Golden Eagle textbook wake up. It was smooth and it was simple.
I really do not remember a lot of it. It was, I think, the way that it was supposed to happen. I felt a little bit of warmth. I felt good. He explained what was going to happen. And then I woke up and I was back in my original pre-op room and getting ready to be able to be discharged home.
There was a brief exchange, and that I'm sure Catherine doesn't remember. But she said, "This was great." She said, "I feel good. I feel calm. And I don't feel stressed or anything like I thought."
Seeing this program and this process and what I experienced, I am so thrilled that I know, not just from the side of a nurse, but from the side of a patient, that this is the type of care that is being provided to hopefully every veteran out there.
It's a simple strategy. We didn't invent it. We just put it together. It's like assembling a puzzle. It's a solid number for 3.5 years now. We've had no lost IVs, no lost airways, no patient injuries, and no staff injuries. None, zero, since fall of 2018.